Hi, I'm Liz from Soul Care Psychology, and this short video is to explain what cognitive behaviour therapy is. Cognitive behaviour therapy is one of the therapies that I use in therapy, and most therapists do use it. We are trained well in it. You may have been told by your doctor or read a book that says, that CBT would help you, and you're wondering what it actually is. So cognitive behaviour therapy is a form of psychological treatment that's been demonstrated to be effective for a range of problems, including depression and anxiety, or alcohol or addictive kinds of behaviours, as well as relationship difficulties. Research studies suggest that CBT leads to significant improvement in functioning and quality of life. The CBT methods have been developed to produce change. So CBT is based on a few principles, including that psychological problems are in part due to faulty or unhelpful ways of thinking. That psychological problems are based in part on learned patterns of unhelpful behaviours. And people suffering from psychological problems can learn better ways of coping with them, thereby relieving the symptoms and becoming more effective in their daily lives. CBT treatment usually involves effort to change thinking patterns. These strategies include learning to recognise, so being aware of one's cognitive distortions or the self-talk that we have every day that's causing our problems, and then reevaluate them in the light of what's true or what's real. Sometimes that's hard for people, which is why they can need a therapist to help them identify those patterns and to reframe them. Gaining a better understanding of the behaviour and the motivation of themselves and others around them, things that are contributing to their psychological problems. Planning ahead and using problem-solving skills to cope with difficult situations so they're not as reactive. And learning to develop greater sense of confidence in your own abilities. So CBT treatment also usually involves efforts to change behaviour patterns, and so these strategies might include facing your fears instead of avoiding them. Avoiding actually maintains our difficult emotions. Learning how to calm your mind and relax your body so that you're less reactive and you're better able to cope with life stresses. And learning what behaviours they are doing that actually increase the difficult emotions, bringing about change in those. So the psychologist, when you're in therapy, the psychologist and the patient work together in a collaborative fashion to develop an understanding of the problem that you're coming with and to develop treatment strategies. But these are things that you can do yourself if you have the right resources, and I encourage everybody to learn more about their emotions and their behaviours that are causing them difficulty, especially if you're a parent, because as a parent, your children will copy you. We reproduce what we are. So just in general, and I've got this attached to the video online, the CBT triangle really helps us understand the interaction between our thoughts, so what we think affects what we feel, and what we do. Our behaviour, what we do affects what we think and what we feel, and our emotions, how we feel, affects what we think and what we do. So that all three work together. If you'd like to know more about your emotions and how you can change your thinking and do some CBT for your own psychological issues that you might have, then please seek help. And if you can't attend therapy, have a look at some of my online resources, and you might work through them and bring about some of that change yourself. The reason I'm doing these online resources is to help people who can't come to therapy or can't afford therapy or are not sure if they need therapy yet, because we all need more strategies so that we can live life to the fullest, be more joyful and more productive. See you next time.